If you give me 5 minutes of your time, I will simplify congestive heart failure in a way that you will understand it. And if you skip this, you may miss out that one sign that could cost your patients their lives. So stick with me, let's do this. So think of the heart as a pump that supplies water to different parts of the body. And when that pump is faulty, there will be problem in the body. So that is basically what happens when there is a heart failure. So by definition, congestive heart failure is a condition whereby the heart is unable to pump blood that is enough for the body to use. And when the heart does not pump blood effectively, you will find out that there will be buildup of fluids in different tissues. You would find fluid in the lungs, in the peripheral tissues, and also some cells in the body would be dehydrated. Why? Because the heart does not supply them enough blood for their metabolism. There are various causes of congestive heart failure. We have hypertension, we have heart attack, also known as myocardial infarction. It could be obesity. It could also be it could also be other cardiomyopathies, drug abuse, and also fluid overload. See, let me tell you, if you administered any IV fluids and you don't regulate the IV fluid properly, it would cause fluid overload that could lead this patient to heart attack. So next time you're administering a fluid to a patient, it's important that you monitor this fluid properly so that the patient is not going to have fluid overload. Now, one dangerous thing about congestive heart failure is that it can complicate itself. Here is what happens. When there's congestive heart failure and there is edema, that is, fluid is retained in some tissues and some other tissues are dehydrated, the kidneys may not receive enough fluid. So they'll be like, oh, there's dehydration in the body. So it would activate the RAS, that is the renin-angiotensin aldosterone system, that will cause vasoconstriction and increase the absorption of sodium in the body, which will further lead to fluid retention and increased blood pressure. That is to say that congestive heart failure or CHF can complicate itself. I have already done a video on the renin-angiotensin aldosterone system, that's the RAS. So I'll link that video up here so that you can go and see that video for yourself and understand it better. There are so many signs you may see in a patient that will tell you that they have congestive heart failure. And the first one is the peripheral edema. You find edema in the foot, you find it in the face, that is puffiness of the face, and in the limbs. You could also find ascites, that is the build-up of fluid in the peritoneal cavity. And other symptoms include fatigue, paroxysmal nocturnal dyspnea, that is sudden breathlessness at night. You also find that the person may gain extra because of the extra food that the body is saving. You also find hypertension. You also find that this patient, you also find wheezing because there could be accumulation of fluid in the lungs. Now, having known the signs and symptoms of this, let's know how we can manage our patients if they are having congestive heart failure. For the management, we're going to start with assessments. So you want to monitor these patients for edema and also check these patients' weight daily to know how the body is dealing with the fluids. Next thing you want to do under the assessment is that you monitor the input and output of these patients. So these patients could be catheterized so that you can get urine output, and every fluid that gets into the body of this patient should also be documented so that it will give you a baseline data of how this patient is being managed. Now, the next thing you want to do is lifestyle modification. You want to make sure that you restrict fluid intake for this patient. You also restrict sodium intake. Now, sodium is contained in the regular salt that's used in cooking, and then highly processed foods like your sausage and whatever. So you want to make sure that this patient has limited access to these things because it could cause fluid buildup in the body. Now, the next thing you want to do for a patient is the pharmacological management, and this includes the diuretics. We have diuretics like the spironolactone and the furosemide or Lasix. So these medications will help to flush out the excess fluid that is in the body. You also want to manage the patient's blood pressure with ACE inhibitors or calcium channel blockers, depending on the situation that that patient is having. You also want to make sure that the patient takes their medications meticulously, because if they don't, it could complicate the issue further. That will be all for now. So in our next video, we're talking about the difference between the left-sided and the right-sided heart failure. So do want to like this video and leave a reasonable comment and subscribe to this channel so that you don't miss out on the next upload. I will see you on the next one.